Welcome to the Gum Guru, the podcast where we talk about all things gums, implants, and oral health. In each episode, Dr. Macon Singletary of North Raleigh Periodontics shares tips to keep your teeth and gums healthy.
Welcome to the Gum Guru podcast. Thank you so much for being here with us today. I'm Jason Kong alongside Dr. Macon Singletary of North Raleigh Periodontics. And Dr. Singletary, thanks so much for getting us together for another episode of the Gum Guru. I hope your summer's off to a nice continuance here as we celebrate a Stanley Cup.
Oh gosh!
In the area.
Congratulations to the Canes. It's something else. And yes, this is my favorite time of the year. I like it hot. I like to sweat. And having the Canes win the Stanley Cup just makes it all much more fun.
It absolutely does. It was a fun ride for sure to watch the Canes win, and now we get to enjoy our summer a little less dramatic than watching the NHL playoffs. Well, Dr. Singletary, we're going to be talking about implants and who they're right for and the proper fit for implants. But let's start with the basics. So, for someone who's interested in this subject, let's just start with what is an implant?
Okay, so an implant is a artificial material, titanium usually, or zirconium. Those are the two best materials. And they're used to, they're in a bullet-shaped form, so to speak, like root form, and used to replace teeth that have been extracted for whatever reason. Rather than doing a bridge, which a bridge is you cover a space. You have a crown on one side and a crown on the other. In the middle, you have what we call a ponic, a false tooth. Well, rather than manipulating the teeth on either side, we could put an implant in the space and not have to mess with the adjacent teeth. So it's a nice way of replacing a missing tooth without involving other teeth.
Okay, so now we know exactly what an implant is. Let's talk about who this is right for, because we're bombarded oftentimes with advertisements when it comes to implants, and maybe this has been suggested to a patient in the past. Can anyone get an implant, or are there some considerations that we need to have for who's the right candidate?
Definitely, there's some considerations, and we used to think the implants are the greatest thing since sliced bread, but we've come to know that that's not the case. Brandon Mark started this journey, gosh, in the early 70s, and he was a German researcher, surgeon, and did them in a sterile environment, an operating room. Of course, the mouth is the most non-sterile environment you can be in, so we quickly found out that wasn't necessary. But Brandon Mark started this journey of osseous integrated implants that look like a root form. And they're not for everybody. It's very important to understand why you lost the teeth to begin with, or tooth. So there are four things that we look at, I look at. But the most important aspect of it is to understand, why did you lose the tooth? And what causes gum disease? I have a lot of people come in who have had implants, and I ask them, do you know what causes inflammation or periodontal disease in your mouth? And they can't answer the question. So, having knowledge before putting an implant in, like, well, why did I lose the tooth? Will the implant stay in my mouth? And if not, why not? And those are the things I look at. So being educated in why, your medical history, when I do an exam, the three things I look at, I look at the x-rays, that tells a history, whether they've had bone loss in the past. And if they have had bone loss due to periodontal disease, you can lose an implant due to periodontal disease. The medical history is important, and being able to determine if there's a medical condition that would affect healing, like uncontrolled diabetes or autoimmune diseases. So between the x-rays, the medical history, and the oral exam, where I actually go in and evaluate not just the gum tissue around the teeth, or do they have bone loss, upper jaw to lower jaw, head and neck exam, lymph nodes, the bite, I mean, the occlusion, being able to open. Um, Not everybody can be able to open wide enough to place an implant, and you can get caught. A provider can be in the middle of doing something and realize that he doesn't have enough opening to do it. So there are a lot of things that we look at, but the most important thing is to understand why you lost the tooth to begin with, and then what would be the prognosis long term for that implant.
Yeah, that makes sense because if you're in need of an implant, obviously there was a cause for that, and
Mhm.
figuring out what the cause was and eliminating that so that you can have sustained health,
Mhm.
that makes plenty of sense. Now, for someone who maybe was recommended to get implants,
Mhm.
and sometimes as patients we're presented with things, and maybe we want a second opinion.
Mhm.
What should we consider when another dentist or a different periodontist tells us that we need implants, and maybe we need a significant amount of implants?
Right. Yeah. So, they're getting a second opinion is always a good thing to do. And there are different types of implants out there. There's some where companies have been around a while, like the Nobel system, which Brandon Mark pioneered. And there's ZimV, there's BioHorizon, there's Straumann. There's sort of the implants that have been tested over a period of time and have a good track record. Not to say that there are other offshoots that don't have a good track record, but you may be paying a little bit more for an implant system that does have some history. I much rather do that myself rather than going to the cheapest route. Cheapest is not necessarily good in the implant world, and using the parts associated with that company is always important. Sometimes labs and even the provider won't realize this, that they may put an implant. But the main thing is to get a second opinion. Implants are not for everybody. I've had people come in and say, "Well, I have an implant. I didn't realize I was supposed to brush and floss it. I thought it was just, it was." So, but the main thing is to get a second opinion. Implants are not for everybody. I've had people come in and say, "Well, I have an implant. I didn't realize I was supposed to brush and floss it. I thought it was just, it was metal and you didn't have to do anything with it." No, you got to treat it like a tooth. You have to brush and floss it. And, I tell all my patients, whether they have implants or not, floss and brush 4 times a day. Bacteria grows in your mouth. Two things bring implants down: trauma and gum disease. And, you can't take an implant and start crunching ice on it uh, for a long time because it'll affect integration. The difference between an implant and a natural tooth is the implant doesn't have a ligament. It's implant bone, period. And so there's no mobility. And so if there's repeated trauma on it, it'll break it down. So you got to make sure the bite's right. And so it's not just the fact that you're a candidate. And the things that I look at to make a person a good candidate is one, that their medical history is not compromised, that they don't smoke. Smoking kills implants. The nicotine affects bone metabolism. And even though some patients have implants and been smoking, majority of the implants will start to fail in smokers, or they even won't integrate if somebody's smoking from the get-go. That they have periodontics that are stable. If they have inflammatory gum disease, they should not be thinking about implants. If they lost their teeth due to periodontal disease, they should be aware of the fact that they could lose the implants. And the last thing is they have width, height, and depth of bone. And there are so many implant systems out there. There are systems where they call it all on four, where somebody is completely edentulous
Mhm.
and they put implants in and a bridge on it. And, that's an expensive protocol. And there are a lot of people that have their teeth removed and go that route. And they really need to be careful about that. Um, it's nice to have something that doesn't come out, but these all on fours have to be taken off at least once a year and cleaned and put back on. There's screws associated with it, and these screws can strip. Um, so it's not just straightforward, oh yeah, I'm going to have something that doesn't come out, even though they might be a candidate. Somebody that lost their teeth due to decay. There are 4 kinds of patients that I see: good teeth, good gums. Rarely see them maybe for implants or gum grafts. Soft teeth, good gums, same thing. They're susceptible to decay, but not necessarily to periodontal disease. Then there are people who are susceptible to periodontal disease, and their teeth are hard as rocks. Um, and then the bless your heart group, people who are susceptible to decay and periodontal disease. So if decay is an issue and gum disease is not, implants may be a good option, even the all on fours. But I always try to talk to patients about, you know, if you have a failure, what can we do to bail that out? And you know, if you have a fixed like 4 to 6 implants with the bridge on it, upper and lower, you know, if you have an implant failure there, um, even though you got other implants, it does compromise the device. Um, if you have an overdenture, which is implants with a denture on top of it, that gives you some wiggle room. And so, you know, having this discussion before you commit yourself, if you're a dentulous, to all implant board and prosthesis, or you're partially a dentulous, some people may recommend, oh, take those teeth out and do all on fours. I would always lobby for, if you can save your teeth, no matter what, try to. And it depends on the person, but getting a second opinion, it'd be smart.
That's, again, good to know so that we can make the right steps when it comes to making a big decision like this. And Dr. Singletary, let's say that we are a good candidate for implants and we've maybe made the decision in our minds that we want to move forward with the process. What are some steps that patients can take to set themselves up for success when it comes to getting the implant procedure done and maintaining them?
Yeah. So the best thing to do is make sure that if you have teeth and it's 1 or 2 implants, it could be 3 or 4, that periodontally are stable. Recognize the other factors that could affect the long-term maintenance of implants, and that is medication that they're taking, smoking, um, identifying in the provider, be it a dentist or periodontist, which should be able to help direct that. You know, are there habits that need to be addressed? Some people like to crunch ice and, you know, or eat almonds. Um, Clenching and grinding is a factor. So being aware before you go into that, you know, what are things that could affect the healing of the implant? And then once that's done, you know, how is it maintained? You you don't necessarily maintain an implant like a natural tooth. You have to have special tools. You can't put a normal curette and scale an implant that desecrates the titanium surface or the neck of the implant. So you have to have certain titanium instruments. And so being wise about, okay, I'm going to get one in, but what's going to happen long term? What's the prognosis, and what would the patient need to be aware of? And that information really should be discussed right up front. The most important thing is understanding what causes inflammation in the mouth. You know, I have people come in that have implants, and I ask them, I said, you know, even with some of my colleagues, you know, I ask them, you know, do you know what causes gum disease? And they can't tell me. And that's a problem, you know, because if they don't understand that bacteria grows in the mouth and it can cause implants to fail, it sets them up for maybe failure. I had a patient the other day. There are 3 things I do to check an implant, and very simple. And even though I may evaluate implants and, you know, turn them back over to the general dentist and let them, I'll see them once a year for assessment. But it's a very simple thing. It doesn't cost much at all. They come in, it takes me about 15 minutes. I push on it, I tap on it, and I floss it. Shouldn't be tender, shouldn't have bleeding, shouldn't have mobility, shouldn't be, and it should be solid. And the other day, 6 months ago, actually, yeah, it was 6 months ago. This patient came in and there was bleeding on his implant. I said, you need an antibiotic, come back in 2 weeks. He didn't want to take the antibiotic, and he just said, yeah, I'll floss it and I'll take care of it. I said, okay. So he came yesterday, and when I went in to look at him, you know, my hygienist wanted me to check him first. I went in and I looked at it looked good. And he said, oh, it's fine, not a problem at all. You know, it feels great. Pushed on it, and there was exudate coming right out of the implant. I mean, the implant had, that's peri-implant mucositis or gingivitis around the implant, but in his case, he already had bone loss, and it didn't hurt. he was chewing on it, no problem, didn't notice bleeding when he was flossing. But on that evaluation 6 months ago, I recommended an antibiotic and he didn't take it because he felt like he didn't need it. And it was really very aggressive look. And so even though you may not feel it or it feels okay to you, it's got to be evaluated. It's got to be checked out. If you're not susceptible to gum disease and you're getting your teeth cleaned twice a year, your dentist may check it. But if I'm following it once a year, separate from what the dentist does, I'll have a patient come in and I'll check it like I just told you. And it's just a safety valve, even though, I always say if it hurts, it's like high blood pressure and glaucoma, it's curtains.
That's right.
And even in his case, it didn't hurt, so you may not even know it. Ignorance is not bliss, that's for sure.
No, not when it comes to our health. And for someone who is not a candidate for implants, let's say they've come in and they've had an exam and we find, okay, we're not a candidate for implants. Can that be changed? Can a patient take steps to where they can eventually become a candidate for implants?
It depends. It depends, if they're smokers, if they've stopped smoking. Some of it has to do with width, height, and depth of bone. And there's certain limitations there. There can be procedures that can do ridge augmentations or sinus lifts. Again, these people, to begin with, why do they lose the teeth? So if it's due to periodontal disease, now, if you have somebody that's susceptible to gum disease and you remove all the teeth, the bacteria that causes periodontal disease doesn't have any place to grow. So you have more aerobic bacteria. But if you start putting implants in, you can set up the environment again for those bacteria to grow. The two things that we have no control over. You inherit the makeup of the saliva and you inherit your immune system. So even though you take teeth out, eliminate a place for the bad bacteria to grow, you put implants back in all on four, where the nooks and crannies are difficult to clean, that bacteria will start to grow back. So in that case where somebody did lose a tooth to the periodontal disease, maybe an overdenture concept where the prosthesis comes out and the implants can be cleaned easier. They can be implants that, with a little ball on them in the denture base, there's a little cup in the denture base that fits on those balls. Prevents rotation, adds adhesion. Or it can be a bar, and the bar is easy to clean and to clip it on. So there are options. And if there are natural teeth, obviously, somebody with significant autoimmune issues or taking Prolia or having osteoporosis and things that affect bone metabolism, do a bridge. Go to option 2, a bridge or partial. Nothing wrong. I mean, some people, well, I don't want anything I have to take out of my mouth. Well, one, partial is the most inexpensive way to replace missing teeth. And depending on what teeth are left, some partials do great. You save a lot of money, and you got a bailout mechanism, because sometimes if you got some weak teeth in other areas, you can always add those teeth to the partial and not have to redo the partial. So there are options, non-implant, but even with somebody that's susceptible, using implants, but having a little bit less aggressive restorative approach to it.
Gotcha. So some of it, well, a small portion of it is within our control, but most of it, we may not be able to control at that point if we've gotten to the point where we need some implants.
Yeah.
Well, for folks who are still wondering about implants and they may have other questions, are there any other popular questions that you get related to implants that we haven't addressed so far in this episode?
Yeah, most of the time it's people come in and say, I don't want anything to have to take out of my mouth. And I said, well, then we talk about, is the implant an option? Is the bridge an option? Sometimes, they'll come in and, well, I hear implants, you can replace teeth with implants and you don't have to take care of them. I said, no, you got to brush and floss them, and you got even more so. But it is a good option. It's probably the most expensive way to replace missing teeth, but in some cases, the most advantageous, because you don't have to mess with it. You don't have to put crowns on the adjacent teeth, or and do something to them that could affect their long-term prognosis, like maybe needing root canals and things like that. So yeah, I mean, I think the main thing is being aware of, do you have options? But ask the question, and if somebody says, what, you, how do I replace these teeth? Get a second opinion.
Yeah, and I would encourage anyone who's in need of a second opinion, if you are speaking with someone who's not taking an educational approach like we've discussed on this episode, where figuring out what the cause is of the issue and making sure that we're treating that cause, as opposed to just trying to put a Band-Aid on a solution that is ultimately going to be set up for failure if we don't address those root causes. So we appreciate that educational approach that you have, Dr. Singletary. And for folks who are watching The Gum Guru for the first time, we always have an action step within our episodes. What's the action step that we can take after watching this?
Well, I think the most important thing is if somebody has missing teeth and they say do implants, get a second opinion, and make sure that that you have all the information you need about the long-term approach, long-term success in your mouth, not just in general. I mean, I go to seminars and I see providers, surgeons put up cases and they look great, but 20 years from now, are they still looking great? They may look great there. Also, how many failures have occurred and what causes the failures? So not. I mean, I put implants in that fail. Why do they fail? I know why they fail. That's why I don't want to do them, and people think they're not going to work because I don't want them to have to spend the money. So being wise about that's the most important thing. Getting a second opinion, make sure they understand, what are the options.
Yeah. And if you're here with us on this episode, you're off to a great start. You're looking for more information. And if you would like to take that next step, maybe get a second opinion, reach out to North Raleigh Periodontics. Click on the link below. Down below this episode, you'll find plenty of information there. That's going to do it for us today on this episode of The Gum Guru. We thank you very much for being with us today, and we hope you'll join us next time. On behalf of Dr. Macon Singletary, I'm Jason Kong. Thank you so much for participating in The Gum Guru.
Thanks for watching. Be sure to like and subscribe so you don't miss more tips to keep your mouth healthy. Learn more by visiting NorthRaleighPerio.com.